Hi guys, this is Dr. Shanice Carrington. On today's segment, we are going to be talking about the shoulder and common injuries that come along with that. I want us to start off talking a little bit about anatomy so we can understand what we're talking about foundational wise, and then we're going to talk about common injuries we see in the clinic all the time, and then we'll finish today's segment with common sports injuries we're going to see specifically in the world of football. So the shoulder joint itself is comprised of a ball and socket. The nice thing about this is that it's really mobile. It allows you to do a lot of different motions. You can do almost every degree of motion you could think of with your shoulder joint. But with all that mobility, we do lack stability. And stability just means how well can you maintain contact with the ball in the socket while the shoulder is going through all these different degrees of motion. If we don't have good contact, this is important to remember for later. If we don't have good contact, we can't generate good strength. So you need stability in a shoulder that's mobile, which is a hard thing to do, which makes the shoulder joint so complicated in itself. But common things we'll see is that you'll hear people get like labral injuries all the time. Your labrum is just, again, we're back to the ball and socket, right? Your labrum is an extra piece of tissue that sits on the inside of the socket that kind of serves as like almost like an extra suction seal. So if people have injuries with this, it kind of compromises some of their stability. And we'll get into that a little bit more towards the end when we talk about some of these sports-related injuries. But common ones we see all the time, I'm sure you guys have heard rotator cuff. You always hear that term. Rotator cuff tendonitis. I tore my rotator cuff. Oh, I had surgery for my rotator cuff 5 years ago. Your rotator cuff mainly consists of 4 different muscles that turn into tendons and help to stabilize your shoulder. 2 of the muscles kind of insert onto the back end of your shoulder joint. 1 kind of goes on top of the roof. And the 4th one kind of is from your armpit and inserts to the front end of your shoulder joint. Now, when people tear them, they normally tear 1 or 2 of these tendons at a time. Sometimes you're going to need surgery for that. Sometimes you won't. But you need your rotator cuff to be a well-functioning part of your shoulder because it's going to be almost like the contractile part of your shoulder that allows to keep you in this stable condition in the first place. If your rotator cuff is not functioning the way it should be, we don't get that same good congruent contact that we need when we're moving our arm overhead, lifting overhead. So if there's any type of tear or issue in your rotator cuff, you'll have people have difficulty lifting their arms over their head, especially if they're lifting something heavy. So you'll see these injuries all the time because there's a lot of things that we do in our day-to-day that cause us to be at higher risk of rotator cuff injuries. For one, that's why I want to talk about posture, because that's a big component. A lot of times you'll see people have it's almost like these rounded shoulders because you're kind of sitting in this type of posture. The issue with that is that you kind of mess up the anatomy of where this shoulder joint is supposed to be. In a perfect world, you want that to be pretty much like in line with your ear. But when people have poor posture, you kind of have the ball is sitting in front of the shoulder rather than right in line with it, which already is going to throw off some of the mechanics and cause further risk of injury in the future. With this, you also get tight muscles in the front. Your pecs get super tight. A lot of the muscles that cross the shoulder joint in the front get tight, and it kind of pulls you even further into this misalignment, which is also an issue. And then also we're going to have your thoracic spine, which sits between your neck and your lower back. That area of your spine needs to be mobile because your shoulder girdle, which is like your shoulder blade, needs to move in certain degrees, which again, we'll get into in a future video, that also allows for you to have that good mobility, but that good stability. So if you have this poor posture, you're kind of hitting yourself at a bunch of different degrees where you're putting yourself at compromise for shoulder injuries. Not just rotator cuff, there's a lot of tendonitis and a lot of issues that can go along with that, which again, we'll go into further in another video. But just want to show you how much posture plays into this. Now, you can have rotator cuff injuries from day to day. That's why you hear about it all the time. It's a common injury. So it also happens from like repetitive motions, whether people are doing like a lot of overhead work or they're doing manual work and they're doing like same motions over and over throughout the day. But you can also see them from trauma, which just kind of brings us into the sports world a little bit. So with sports injuries, you can get hit in a certain degree, you put too much compromise and stretch on a certain tendon, you cause a tear. Now you have a traumatic rotator cuff tear. That's common, you see that all the time. But another common injury you're going to see is like dislocations and labral tears. So let's get into that a little bit. Shoulder dislocations. The most common one we're going to see is an anterior dislocation, which means, again, if we have this ball and socket joint, that the shoulder is going to be dislocated to the front of the shoulder. Most of the time, the reason this becomes an issue because this is the position that puts you at a compromise for that. The shoulder is abducted, it's externally rotated, and it's a little bit in an extended position, which kind of puts you get hit, whether you get hit from the back end or you're hitting and tackling somebody from the front. You kind of put yourself in that compromising position to allow for that ball part to push through the shoulder joint, and that's how you get a dislocation anteriorly, which is like 95% of most injuries and dislocations are going to come through the front of the shoulder. Now, this becomes an issue, one, because you have a higher chance of redislocating that shoulder. You have kind of like this joint capsule that surrounds your shoulder, and when it comes through the front, you kind of cause for all those, almost think of it like a rubber band that helps with a little bit of joint stability. When you push through the front, you kind of stretch them. If you think of like an overstretched rubber band, it doesn't recoil very well after that, so people have a higher chance of dislocating. Now, on top of the dislocation itself, you can have fractures after your shoulder pops out, or when it comes back in, you have two different chances to fracture your shoulder. On top of that, now we have an issue with the labrum. So remember, we were talking about the labrum before, right? When you dislocate your shoulder, one labral injury you can have is called a slap injury, which is basically saying your bicep has a tendon that goes through the top of your shoulder and inserts into your labrum. Now, if your shoulder is dislocating and is coming through the front, and remember that bicep is the first thing that's kind of blocking that, you cause an injury where you push onto that bicep and it kind of causes like a front to back tear. And that tears the bicep, but it also tears from front to back that labrum. And that's what we call the slap injury. That's one thing that can commonly happen from dislocation. Another injury that can happen is called like a Bankart lesion, which same thing, we're in the same position, we're dislocating through the front, and then that same ball is gonna be pulling off a little bit of the labrum from the front end of that shoulder. And that's also an issue because now we're lacking stability and we're kind of messing up that whole suction seal I was talking about in the first place. So a lot of times when people have labral injuries after a dislocation, depending on the degree, a lot of times they're going to need surgery. Very similar to Christian Gonzalez, like a month ago, also went through the same injury. Shoulder dislocation. I think they already said that he's going to need surgery. So he's probably going to be out for the next 4 to 6 months. We'll see him next year because he has to go through rehab for that. Now, not all of these injuries are going to need surgery. Sometimes people can dislocate their shoulder and then they rehab really well. It depends on if they have labral involvement, if they're redislocating a bunch of times after they've dislocated the first time, whether or not there was a fracture site, the degree of the injury in the first place, what sports do they have to get back to? Are they going to have to get back into that same position over and over again? So it pretty much is between you and your orthopedic surgeon whether or not you want to do surgery. Most of the time, you're going to go through conservative rehab first, see how you respond to that, and if that doesn't go well, go through surgery. But again, it depends on the person, whether or not they're an athlete, what they're trying to get back to. But the shoulder it's an amazing joint because it's so mobile, but you still need all this force and generated command from it. So that's why it's so prone to so many injuries. But in a future video, I'm going to go through common injuries that we see, different exercises we can do to kind of eliminate our chances of getting injuries in the first place. A lot of it's going to be posture work, certain muscle groups we have to hit. But yeah, that's pretty much my segment on the shoulder for today. I'm curious to see how Gonzalez is going to recover from this in the next few months. I'll just look up for updates, and if I hear anything, I'll let you guys know. All right, guys, thanks.